Today we are going to talk about how pilocarpine used in restoration of near vision in just 1 hour. Pilocarpine eye drops, it's a revolutionary thing in the treatment of near vision or hypermetropia and within 1 hour. Means it's a revolutionary breakthrough in presbyopia treatment that's changing how we approach the age related vision loss. Age related vision loss. The presbyopia challenge means the global impact. Over 1.8 billion people worldwide struggle with age related near vision loss, that we call it as a age related presbyopia at the age of 40 or after 40. The presbyopia is very common, means making simple tasks like reading menus or texting increasingly difficult because it will affect your near vision, presbyopia, or you can say hypermetropia. The number continues to grow as population age, creating an urgent need for better solutions. Better solution means what is the options that we have, what are the current limitations that we can say. Traditional solutions include reading glasses that we use normally or surgical procedures, both with significant drawbacks and inconvenience that affect daily life. Means what is the options for that? We use the reading glasses for the near vision or the surgical procedures, means intraocular lenses, the surgeries, but there are limitations or drawbacks for that also. So, a revolutionary alternative, a pharmacological treatment. What is that pharmacological treatment that we have? FDA approved 2021, in 2021, the pilocarpine eye drops. It is just a meiotic pilocarpine eye drops received a FDA approval with the brand name Vuity, Vuity, as the pioneering brand in this new category. It is just a meiotic, pilocarpine. It's a cholinergic drug, pilocarpine, which causes constriction of the pupil. Right? Now, enhanced formulations like new combination with diclofenac provide improved comfort and effectiveness while reducing the side effects. It is pilocarpine is combined with the diclofenac. Pilocarpine combined with the diclofenac, and it will improve the comfort and effectiveness, and it will reduces the side effect. It's a non-invasive restoration, non-invasive restoration or natural restoration that we can say. Non-invasive drops restore the eye's natural focusing ability without surgery or permanent changes. Then how it will going to work, how this pilocarpine work? First of all, we know that it's a meiotic. If it's a meiotic, it causes pupil constriction. So if it constrict pupil, so it will create a natural pinhole effect. It will create a natural pinhole effect that increases the depth of focus for the clearer near vision. How it will going to work? It will create a pinhole effect. Means it will increases the depth of focus for the near vision. Then it will also cause muscle activation. The medication activates the ciliary muscles of the eyeballs that will restore the eye's ability to change shape and focus on a closer object. Muscle activation means it will activate which muscle? Ciliary muscle of the eyeball, and restore the natural eye ability to change the shape and focus on a closer objects. Anti-inflammatory support. So we combine pilocarpine along with the diclofenac that will reduce inflammation, anti-inflammatory effect, and mitigates the potential side effect, enhancing patient comfort and compliance. Rapid vision improvement, clinical evidence. Means it is a FDA approved combination, pilocarpine along with diclofenac. Means they have studied 766 patients in which there is a comprehensive clinical trial demonstrating consistent near vision improvement within the first hour. You need just 1 hour to clear your or to restore your near vision. 3.5% lines gained average improvement on a Jigar near vision chart representing significant functional enhancement. If you go for the near vision chart, Jigar's near vision chart, it will represent the significant functional enhancement, and 99% is the success ratio. Patient on 1% pilocarpine could read 2 plus additional lines comfortably after eye drops. That's a simple thing that we can do. Sustained benefits over time means long term success is also there. What is the long term success? Vision improvement lasted up to 2 years with consistent twice daily use. 83% maintaining functional near vision at 12 months. Users gain independence from the reading glasses for daily activities like texting, reading menus, or close up work. Whatever that work you are doing, for cooking, for reading, for watching TV, or anything that you want to do, right? It's a sustained benefit over long term period. Now, what is the safety profile or side effects of this drug? Milder side effects are there. Milder side effects like means there is a chance of temporary headache, there is a redness or mild eye redness or minor irritations will be there, and these effects are generally very short lasting and well tolerated by the most of the patient. Safety profile: no significant adverse events like increased eye pressure or retinal detachments reported. There are nothing like retinal detachment or increase in the intraocular pressure. Extensive monitoring shows excellent safety records across the diverse patient population, right? Then important precautions that we have to take. Caution should be taken for the patients of narrow angle glaucoma and retinal disorders. Those who are having retinal issues or narrow angle glaucoma, in that particular patient that we have to take care. Regular ophthalmic evaluation recommended to ensure the continuous safety. If you are concerned, then you can go for the continuous evaluation of your eyes, right? Real world impact means there's the patient stories. What is the feedback of the patient? The Sarah M, age is 52. He's saying, I am finally tossed aside my reading glasses and regained the youthful near vision I thought was lost forever. That I was lost forever. My quality of life improved dramatically. I can read restaurant menus, use my smartphone, do the detailed work without constantly searching for my glasses. Robert, age 48. So these are the real feedback given by the patients. Means these drops offers a convenient non-surgical options, non-invasive option for millions who aren't candidate for the surgical procedures or to prefer to avoid the invasive treatments. So limitations and considerations. I think limitation means effect lasts for 4 to 6 hours. It's not a permanent effect. It will remain for that 4 to 8 hours. Means it requires at least twice daily dosing for sustained benefit throughout the day. Or partial solution. Some patients may still need glasses for very small print or low light conditions, or monitoring required. Regular eye exams needed to monitor for rare complications and ensure continuous safety. So future of near vision correction. So means we can say that pilocarpine drops represent a fundamental change in the presbyopia management, moving beyond the traditional corrective approaches. Continued research focus on the optimizing formulations, improved duration, and ensuring long-term safety profiles. And it's a worldwide impact like promising step towards the spectacle independence for aging eyes across the globe, offering hopes for the billions. Thank you.